Okay, good afternoon, everyone. My name is Mark Cooper. I'm the president and CEO of the Saskatchewan Construction Association. For those who don't know, the Saskatchewan Construction Association represents the construction companies here in Saskatchewan. So there's about 9,000 or so companies that operate mostly in the commercial and industrial space in construction, but also in the multi-use residential and horizontal construction like road building and pipelines and things like that. And there's about 55,000 workers that work in the industry, making it the second largest private sector employer in Saskatchewan. And so our job as the Construction Association is to be the voice of those companies, primarily when it comes to provincial advocacy. But in times like today, we're very much involved in providing information to our members and being connectors for them to experts in a variety of fields, which is why I'm so thrilled today to have our four guests. It's the most amount of doctors I've ever had, I think, on one call. So I'm very excited to be joined by Dr. Reeder, Dr. Leis, Dr. Neudorf, and Dr. Janzen. And I'm going to ask each of them to give a little bit of introduction about themselves, and then we'll dive into some questions. So maybe we could start with you, Dr. Leis.
Yes, good afternoon. My name is Leis. I'm the department head of Community Health and Epidemiology in the College of Medicine at the University of Saskatchewan. My background is more in the social sciences, health promotion, psychology, and working with cancer. But that's it. Have been in the department for a number of years.
And can you maybe just give a quick overview of the Department of Community Health and Epidemiology?
Sure. So the department is formed of faculty. So we have, faculty, academic faculty in the College of Medicine, affiliate, mostly PhD faculty, who are really an interdisciplinary group in biostatistics, epidemiology, the nutrition, health promotion, anthropology, etc. So a whole gamut of disciplines related to the health of populations. Our core business is population health and preventive medicine. And then we have faculty who are medical faculty, who are public health physicians in the province. And we have also some of us like Dr. Neudorf, who is a public health physician, but is actually an academic researcher as well, clinicians, so who have spent most of his time doing research. So overall, we are about 35 faculty, plus 35 to 40 right now. Okay,
thank you. Dr. Reeder.
Thank you, Mark. So I'm a retired professor from the department, physician and public health specialist, and have worked in some settings with outbreaks of disease in different locations around the world, and I'm happy to help contribute to the current control of the outbreak in Saskatchewan. Thanks.
Thank you. Dr. Janzen?
Hi, I'm Bonnie Janzen. I'm a professor in community health and epidemiology, I think about 20 years now. I'm a social epidemiologist, so I focus on how socioeconomic factors impact health. I'm interested in things like gender and health and so on. So I'm not a physician, but I am an epidemiologist, mostly focusing on mental health aspects of health. So thanks.
Very highly relevant in today's conversation, isn't it, really? Yeah.
Yes, yes.
Thank you so much for joining us. Dr. Neudorf.
Hello, so I'm Corey Newbold, a public health physician, worked as a former medical health officer for the Saskatoon Health Region and do some contracting with the Public Health Agency of Canada as well. And I've been on faculty here since 2011. Working primarily in areas of improving health equity and improving quality improvement in public health services.
Wonderful, thank you. Well, thanks to all of you again for joining us. Today's conversation is intended, as I mentioned, to be a precursor to the creation of an article for our magazine, We Build magazine. And when I was preparing for this, I was trying to put myself in the shoes of our readers and say, what are the questions that are really on their minds? And so I'd like to start with this one, which is, what's the big deal with COVID-19? You know, in a place like Saskatchewan, where we haven't seen the kind of significant community spread that we have seen in other jurisdictions and the kind of major outbreaks, I think people are wondering, is this really that serious? And what's the big deal? So there's a lot in that question that you could unpack, and I'll leave it to you to unpack, but who'd like to start by saying why we do need to take COVID-19 seriously and what it's all about?
Let our physicians go with that first.
Corey, how about you give it a start?
Sure, I can start off. Well, I think all you have to do is look around the world to see why we need to take this seriously. There have been other countries that were hit harder, faster. We in Saskatchewan were kind of late to the game in seeing cases. Canada was even behind other countries. So in a way, we've benefited from being able to watch what others have done, how the virus has behaved in other countries, and therefore can take our cues from that. So this is a virus that's brand new. So that means no one has had immunity to it before. And you need to take it seriously because everyone can get it. And what other countries have shown us is how many people can get it, how quickly, how it's spread, and how quickly the hospitals can get overwhelmed if it's left unchecked with completely overrunning a hospital and causing many, many deaths and a lot of severe sickness.
So is it fair to say that the efforts targeted at this are not so much in stopping the virus, but more in slowing the spread?
Yeah, and I think that's very fair. There, at the beginning, it wasn't clear whether it would be possible to stop it quickly, and there have been a few other similar outbreaks in the past decade where a virus like this, the most recent one being the SARS virus that hit in 2003, where we were in fact able to just stop it, and we don't see that anymore. This virus is closely related to that one, but it is spread easier and it's far more difficult to contain. So efforts very quickly moved from trying to eradicate it to drastically trying to slow it down.
Dr. Reeder, anything you'd like to add to that?
Oh, I think it may be worth just comparing it to influenza, to which it is compared at different times. It tends to spread more quickly than influenza. It's considerably more deadly. That is about 10 times the what's called the case fatality rate. And it appears to spread a considerable amount before symptoms develop, and that is not so prominent with influenza. So for these reasons, it's worse than the seasonal flu. And worse than some of the previous outbreaks or pandemics of influenza. So attention needs to be paid to it, as we've seen from other countries and even other provinces in our own country. Saskatchewan has done quite well, and I think in part because we were later in being exposed to it and the systems were up and running. The social distancing and protocols went into place, and I think must have been fairly well adhered to. But that doesn't mean we couldn't again have resurgence of the disease.
Dr. Janzen or Dr. Leis, anything you'd like to add to that?
No, I think what Dr. Neudorf said about that it is brand new, and part of the concern is, and I'm thinking they might agree with me, that we really don't know that much about it, and we're learning as we go, which again makes it more important to focus on it. A lot is unknown.
Yeah, absolutely.
Yeah. And maybe what I could just add is kind of on the social side, the fact that it's unknown and it kind of provokes a lot of uncertainty and anxiety, because when you don't know exactly where it's going to go and what it is, it's much harder for people to cope with uncertainty or things that they don't know. And so it has really created a toll, and the messaging around the social distancing, you know, on one hand, and paying attention and so on, but also really paying attention to, so people don't isolate and don't, you know, can talk to people and stay connected is very important.
Mm-hmm. Okay, excellent. Thank you. So we understand that it is something we need to take seriously. It's different and more and riskier than influenza. There's still lots of unknowns, which adds to the risk factor. What do we know now based on, say, experiences with other viruses, similar viruses, in terms of where we're at with respect to the progress of the virus? So I don't know if it's appropriate to refer to it as, and I'm talking globally here, I don't know if it's appropriate to refer to it as a curve or a progression, but you'd know the right terms. And where are we at in terms of the progress of the virus?
I think globally, the spread of the virus is very different from place to place right now, just because of the nature of how it gets into different populations. We're seeing it at very different stages in different countries. So what we've been able to see, sort of a natural progression, once it gets a hold in an area, it tends to take off very quickly, but also then responding by changing our behavior can slow that spread very quickly as well. And what we're seeing is certain parts of the world are just in the early stages of that virus taking off. Others are coming down out of that first wave quite quickly, and some are just sort of midway between. So it's progressing at different rates right now globally.
So you used the term first wave, and of course there's lots of conversation about subsequent waves, and as I understand it, and my understanding is limited here, but that's to be expected, that there will be additional waves of this, and that those waves may look different as the virus changes or mutates. And so can you give some sense, maybe to start with you, Dr. Neudorf, and then hear from others in terms of what we might be able to expect, drawing from past experiences of what could be coming in the months ahead?
Well, yeah, you're right. Every virus pandemic that we've had in the past has multiple waves, and this one should be no different. The question is, how long are the troughs between the waves? And if we can have a reasonable response to the gradual reopening and close monitoring and being able to watch for new infections, contact trace very aggressively, we can make that trough between the waves very long. But on the other hand, if behavior relaxes too quickly while there's still virus circulating in the community, that second wave can come just weeks after the first wave. So a lot really depends on behavior of the public as to how long between waves that we are and how big those peaks are within each wave. So you mentioned that all of our behaviors we've done so far, all of these changes we've made to social distancing, reducing meeting in groups, and our hand washing and mask wearing and all of these sorts of things have got us to where we are now, which are very low levels. So you can have a false sense of security, and if we just all go back to normal at this point with a small amount of virus circulating, we'd be right back where we were in early March within several weeks. But if we can maintain a balance here, and as we understand more what types of things can resume and what types of activities for safety and need to be maintained, then it can be months between those waves, and when the second wave comes, we can blunt it and keep it very small again, just like we did this time.
Yeah, you talk about the complacency. I know I've caught myself feeling that way some days. You know, I've gone from being not thinking at all about stuff like this to thinking very diligently about it, and all of a sudden, occasionally, I'll catch myself going, "Oh, I want to shake this person's hand" or something like that, or go up, and then you realize, no, of course you can't. I mean, this is going to be, our behaviors are going to be modified for a while if we're going to be successful here. So, Dr. Reeder, let me ask you about that. What's your sense of the length of time that we are likely to have some significant type of modifications, or we're going to need some kind of significant modifications to our everyday behaviors in order to help manage the risk of COVID?
Yes, that's a frequently asked question, isn't it? And of course, the proper answer is we don't know. It in part depends on what Corey Newbold was just discussing. That is how the next 6 months transpires, what the second wave or waves look like. And our colleagues in BC and the University of Toronto have done some nice modeling that, and this has guided, for example, BC's approach to when we were full on social distancing, it was thought that we had about 30% of our usual intimate contacts. And the models suggest that we could edge that up toward 60% of our usual social contacts and have a blunt, low return over the coming 6 to 8 months. But much more than that, it looks like you would get higher waves and perhaps repeated ones. And possibly, if we went right back to normal, a wave that's worse than what we have experienced in the country. If we across the country and the province are able to keep it at a low level, then it will give time for the development of vaccines, which is the realistic option. And there's some hope that by the end of the year or early next year, that could be available. And then the public health folks and society more broadly will have to decide who gets the vaccine, how strongly it's recommended or required in certain sectors or age groups. But until we have a vaccine, then either we need to maintain this lifestyle that we have or accept that we will have ongoing disease in order to build up what they call herd immunity. But ongoing disease, although not much for healthy middle-aged people, it certainly has great consequences for the elderly or those with other disease. Mm-hmm. And it looks like now even for children, there are some untoward consequences that weren't recognized before. So it's a long answer to your short question.
No, but I think you highlight what Dr. Janzen talked about early on is there's so much we don't know. Right, and that's why caution is warranted. And you talked about vaccine and immunity, and I want to circle back to both of those topics in the second half of our conversation. But before we do, there's two other questions I want to get to in this first part. First one's for you to start, Dr. Janzen, which is, Dr. Neudorf talked about how this can spread quickly through communities. I'm curious, although it's likely too early to draw conclusions, what are you seeing in terms of socioeconomic factors or demographic factors that are causing faster or slower spread? And what are we seeing so far that may be telling us about how we need to consider doing health differently in the future as a result of that?
Yeah, that's a difficult question. I think I'm not sure if Dr. Leis mentioned this, but one thing about our department is that we really do approach things from an equity perspective. And I think what we're seeing with this disease, we're seeing a lot of issues that were already there magnified during this time. I guess I'm thinking of things such as we see an increase in things such as domestic violence. We're seeing an increase in things such as racism. And we're seeing, and especially I think this information is coming more from the United States about people of lower socioeconomic status being at greater risk for contracting this disease. So I think those are some of the issues that I see, social and economic factors related to the disease. And Dr. Neudorf, I think, or it was Dr. Reeder also mentioned about the elderly Canadians and how that's, the report out of Ontario about the state of some of the nursing homes. And again, I think it's bringing those issues that I think are always present, but it's magnifying them during this time. So identifying some of these real vulnerable groups and the racism as well. You're seeing, especially, you're hearing more about instances to the Asian people within Canada. So again, these issues are present, but we're seeing them kind of more so at this time in this crisis.
Right, and so it's really putting a spotlight on some of those societal issues that, frankly, we probably should have been paying more attention to earlier on, and now now we're being confronted with those realities. Yeah.
Mark,
Please go ahead, Dr. Reeder. Yeah.
It might be worth mentioning too that there's evidence, and it does make sense, that those there are sectors of society that are not able easily to work from home. The recommendation being working from home, but a lot of folks in middle or lower paying jobs cannot work from home. And so they've either been out of work or try to apply for the government programs, but those only partly fill the gap. Some of the, well, it's clear that the impact of the whole shutdown is greater in the lower socioeconomic groups. And it may be that those jobs disappear, or those companies that formerly employed them in the service sector diminish. So we're seeing it right now, but we may also see it in the months to come, more so.
Right.
And you mentioned that there are some things that, you know, we may stop and go back a little bit to normal, and other things that may need to stay. And that doesn't just apply to the social distancing and hand washing. And I mean, you could argue that on the public health side, we've been asking people to wash their hands and take care of where, you know, not touching your face. And a lot of these things we've been telling people will help you get less illness of all kinds throughout the year. But as we see the responses to the things that you were just mentioned by Drs. Janzen and Reeder, some of the government responses and corporate responses we've seen around changes to the employment insurance and other economic emergency aid, the need for paid sick leave for more types of employees, clear criteria for what types of job safety is needed in lots of different sectors around wearing masks and hand hygiene, reduced crowding, etc. Changes to work hours, separate hours for shopping for vulnerable people, this new concept of curbside pickup and delivery. A lot of these responses we've seen, I expect, are going to gain traction and perhaps need to be maintained into the future for many reasons.
It comes back to pointing out that we've exposed a lot of vulnerabilities in our structure, right, as a society that we need to, I hope, come to terms with. Dr. Leis, I wanted to pick up on something that Dr. Janzen had mentioned about racism being on the rise in some cases here. And it strikes me that part of the challenge with all of this is misinformation, right? And social media doesn't help with that, of course. And the one thing spreading faster than the virus is misinformation about the virus and about the origins and all that, and lots of mistrust. Even now we see about, you know, the World Health Organization and other things like that, and speculation. And can you talk a little bit about the importance of, and I'm not even sure how to phrase this, but the importance of getting the right information and dealing and pushing back against misinformation because of all of the dangers that can help lead to?
Again, this is a very difficult question. It is absolutely true that the misinformation, you know, we have to combat this misinformation and provide the right information from trusted sources. And so, you know, this is kind of what is kind of pressed upon, you know, through the media, the TV, the radio, you know, anything coming from Health Canada, from the Government of Canada, or coming from universities, you know, what is evidence-based. But even within, you know, this, there is a lot of research done right now, and it's kind of the rush to the next question, and then so there are some questions around, well, did we actually do the research properly? Are the results that are presented the right results? Are they going to be corroborated, or they're going to be there will be another contradicting results coming up afterwards? So for the public, it is very difficult, and I think they have to kind of look, you know, as a department, for example, and we're working with the Saskatchewan Health Authority, and we have some colleagues and Dr. Janzen and Dr. Reeder, all of us, we are kind of part of this kind of a platform that is trying to actually collate information and sifting through to actually have the best informed information, I guess, for the health authority in terms of helping them make decisions, and maybe other decision makers at the university level or at the government level to know how to proceed with, for example, the opening the economy, or opening businesses, or moving forwards and then still containing the virus. So it's not a black and white answer, that's for sure.
But it does, again, it comes back to that central premise advanced by Dr. Janzen early on about the idea that, and all of you have commented on this, there's so much we don't know, right? And we are learning as we go, and part of that process means that it's iterative and there will be mistakes made, but to get to the answers, we need to be comfortable learning as we go, really, I guess.
Yeah, and then also maybe I can just say that us maybe as academic, we have to kind of learn to communicate maybe in more simple terms, but and then make sure that people kind of our messages can come across as trustworthy, coming from the right sources, and also kind of try to dispel myths, because social media, it's there is whatever, it's every dog's breakfast, as we say.
Yeah.
Mark, it might be worth just pointing out that there's an evolution that's underway, or you could say that there's as we discover more about the virus and its transmission and what we need to do, our recommendations change, and I think the public is not so accustomed to that. The public looks to the medical profession or the university for answers. What is the answer here? As if that answer were known and not changing, not changeable. But indeed, that's not the case here, because we only know about a third of what we need to know right at the beginning, and we may know about 2/3 of what we need to know now. But as we understand from the world global experience, understand the virus and its transmission better, then recommendations change, and they need to change. And so politicians and scientists and the health community need to be transparent about what we know and don't know. That has been the case for some authorities. For example, Theresa Tam has changed her policy, at a national level on masks, has changed the policy on prohibiting travel. In the early days, as WHO recommended, you don't prevent travel across borders, but that changed. So and one of the premiers chastised her for changing, over the course of 2 months. But indeed, she and others like her need to change when the evidence changes, and the public needs to recognize that that's a good thing. That you're not sticking to a position just because you took it 2 months ago.
Right.
So it's a challenge for the public, I would say.
Absolutely. Dr. Janzen, did you want to add something?
No, I agree with everything that's been said, and just the science is generally slow, the progression of what we know, and I think this is quite an atypical situation, and usually when academics publish, it goes your writing goes through a thorough peer review process, but now articles are being put online for people to access that haven't gone through that process. So academics also have to be careful about what they're producing. There's such a emphasis and pressure to be producing that we have to make sure that we maintain that rigor.
Do we need to
for your members, they may want to know, if fear grows in an information vacuum, and so don't be afraid to ask questions, and just be careful, what's the source you're getting your answers from, and is it a credible source? But, not asking questions isn't the right thing to do. We need to seek out the best information that's available and test it.
Do we need to be worried, do you think, as a from a public perspective, that the fear of criticism? So Dr. Reeder, you used the example of Dr. Tam's recommendations specifically and how that's evolved, and the criticism that she's received specifically. Do we need to worry that the fear of criticism may cause an overreaction in terms of people being too cautious in recommendations or too cautious in coming forward with ideas? I always worry about that you know, the public backlash to uncertainty might cause people to delay in terms of coming forward with ideas because they want to be sure that that they're right. And in a time like this, we can't be 100% sure very often, right? Any concerns there?
No, I would say you're right that there is a concern, and it may that anxiety perhaps on the part of the health community or the academic community may be raised because the consequences are great if you follow an incorrect direction. But in traditionally, and I think also now, the best approach is to present your work, your research, and have it criticized by others who know the field, so that it's open and transparent, so that the best decision can be taken. I've been impressed in the last 4 or 5 months of the epidemic in Canada and around the globe, there's been an unprecedented sharing of information, open access to these medical journals that formerly you had to subscribe to. Now it's free. You get COVID information online, updated daily. And as Dr. Janzen says, some is peer reviewed, some not. So that which is not reviewed, you have to be more careful in your analysis of it. But it is one of the positive things to come out of this is the unprecedented effort to solving the problem and the sharing of information, and even sharing of efforts in the area of vaccine development. That's unheard of before, but it's underway now.
Well, I think that's a perfect segue into the next section. So thank you, because I would like to talk now about vaccines, and that seems to be the magic bullet or bullets that many of us are hanging our hopes on. So let me start with this question. Is finding a viable vaccine probable?
I would say definitely. There are very many vaccine candidates that are at various stages of development in the pipeline globally, including some right here in our backyard that are showing promise. But it all depends on what you mean by viable. And I think the reality is when you're dealing with a vaccine to a novel virus like this, the question is, how effective is it going to be in which populations? How long will that immunity last? And will it prevent infection completely or just prevent serious disease? And the reality is, if we can make any progress in any of those areas, we have a viable vaccine that's going to help us beyond where we are right now. But that's what all the rigorous testing is about right now, to see not just is it a promising vaccine, but answering all of those other questions, combined with how safe is it for all populations. So we have to balance that, those two sides of the coin.
Absolutely. So I think one of you earlier, I think it maybe was Dr. Reeder, but I'm not sure, made the point that it's unusual. Like as a member of the public, I kind of expect the medical community to find solutions to my problems, right? And that you'll have them and you'll know the answers. And so I kind of expect that if we have a virus, you'll find a vaccine that we'll all be able to take that will make us immune from the virus. But I don't know, is that, when it comes to vaccines, is that uncommon? Is it more common? Is it more likely that we'll find vaccines, for instance, as you said, Dr. Neudorf, that may lessen the impact of the virus, or may be helpful for some segments of the population, but not others? So in the pantheon of vaccines, what's the most likely outcome that we will see here over the next little while?
Yeah, so the history of our success with vaccines is variable. We have some vaccines that have been very, very effective in most people, and for a virus that is the only host is humans. And a good example of that is smallpox, where we developed a vaccine and actually completely eliminated it from the world. Then we have others like measles vaccine that is, again, very, very effective, but it's against a virus that's extremely contagious. So it's hard to eradicate it, but it's a very effective vaccine, and you need high numbers of people to be immunized for it to keep outbreaks away. Then you have on the other end something like an influenza vaccine, where depending on the year and how close the match is, it can be 30% effective up to 70%. We're feeling good with a vaccine like that. And it doesn't work as well in the elderly. So where is this one going to land with, we don't have a good coronavirus vaccine for others. Since SARS came out in 2003, there have been groups of people working on coronavirus vaccines. So it's not like we're starting from scratch. But it's still unknown as to where this particular virus is going to fall along that continuum.
Okay, well, good information. Thank you. So do we, I mean, so let me ask this question then. So what level of vaccination, so you made the point, then I guess it does depend very much on the virus. So based on what you've said, but what level of vaccination is typically required for a population in order for us to consider that we're safe from the virus?
Yeah, and again, that depends on the virus. With this particular one, with how infectious it is, the early studies are looking like somewhere between 60 to 80% immunity is likely what's going to be needed to protect the population. And that's a combination of either being immune from a vaccine or from having had the disease previously. Right now, you know, again, it varies around the world as to how hard the virus has hit different cities, but it's looking like in most places that first wave has not resulted in much more than 3% to maybe 10% of the population that's had it so far. And here in Saskatchewan, it's likely less than 1% that have had it. So we'll need a high degree of immunization coverage with a very effective vaccine to really protect the whole population.
Okay. And in terms of, so I want to ask about the reasonable timeline. So, you know, when can we expect something? But I realize that again, it depends a lot on what we're expecting. And, you know, there might be various vaccines that can help out in various ways. So what can you tell us, and may again start with you, Dr. Neudorf, although happy to hear from others on this, about what you're hearing about when we may be able to see some vaccines available for the public that could help here with COVID-19?
Well, normally the vaccine development chain sort of takes at least about 5 years, sometimes up to 10, to really get a vaccine initially studied and then have the various types of trials and safety checks and approvals, licensure, mass production, et cetera, before it goes out and is used widely. When we had H1N1, if you recall, that was drastically reduced to less than a year. That was because we already had a mechanism for delivering influenza vaccine, and we just had to add a new component. So for this one, we're already seeing some vaccines entering human trials. So I think the fastest you could expect to see some initial doses cleared for some of those vaccines to use in people would be 9 to 12 months, and more likely closer to 18 months before you'd see that. And then to get enough doses manufactured for getting most of the population globally, we'd be looking at longer than that. But so much depends on which vaccine candidates end up being chosen and how they're grown. how quickly those tests can be done and what those early results show.
Excellent.
I know, Dr. Reeder, you might have more to add. I know you've been looking at this.
The only thing I might add, Mark, is that as we know, something in excess of 30 promising candidates around the world are under development. And if 4 or 5 viable vaccines come out of that, that's a good thing. In that the ramping up for a world campaign is enormous. And the more vaccine candidates, the more companies and countries producing, the better. So, of course, you'd want vaccines of comparable quality and efficacy, but having many groups work on it is a good thing. So just on the vaccine front, that's important. Another aspect that I think is starting to be looked into is what we do in other diseases. The technical term is chemoprophylaxis. That is, as Donald Trump, I guess, is doing chemoprophylaxis with chloroquine, which turns out not to be a very wise idea, but it's taking some agent, some medication usually, to either prevent the disease or diminish the effects of the disease. And so we do this in certain other infectious diseases, especially with contacts of a confirmed case. So it could be that in addition to the vaccine angle, there's going to be effort targeting chemoprophylaxis. What could we do? There's some general evidence that vitamin D may be useful in the sense that between populations, those with high vitamin D level are less likely to get severe disease. But this is the earliest and most rudimentary of evidence. But something like that needs a more rigorous examination and trial, just as some antiviral agents might prove effective for contacts or individuals at high risk. So there are other avenues that need to be pursued beyond vaccination.
So there is really a spectrum approach here, both in terms of prevention. We've talked about with potentially a vaccine, but there I've also heard about, and I'm just using the term I've heard, but therapeutics, right? So things to help treat people who have it, but to reduce the length of their sickness or the severity of their sickness. And it sounds like all of those things are being explored simultaneously, and what sounds to me like to be in a very collaborative approach across the globe. And is that unique? I mean, maybe not unique, but is that common when it comes to something like this? I guess something like this is an odd phrase for this, but is it common for the community to be as collaborative as it is being right now?
Maybe I could just say something about, it's not common. We in academia, we're quite competitive, and there are groups competing against each other. So it's very unusual to see this level of cooperation. Partly, I think it's because it's a global pandemic. So like it's not affecting, if it was only affecting a piece of the world, a part of the world, we may not be reacting the same way. And at first people said, ha ha ha, it's only in China, ha ha, it's not only in this countries, but no, it's actually everywhere, including North America. So, and it may go somewhere else. So I think there is this kind of realization that, we are one world, and if we actually don't cooperate, we may be in trouble.
It's interesting that with this in mind, the World Health Organization worked on a global treaty to look at sharing information in light of global pandemics or threats to the health of the global population. So there have been treaties signed between countries to ensure that this type of cooperation occurs in a time of crisis. And the first time it was really tested was in the 2009-10 H1N1, where we had unprecedented sharing of information about the virus, how to test for it, information on treatment and on vaccine development that happened very, very quickly between countries at an unprecedented level. So we've learned from that experience, and I think in combination with that, we've had increasing technology around how to better characterize the virus, how to grow it, how to get its genome sequenced, and improvements in the science related to understanding more about a virus. So what we're seeing is those same approaches that were put in place have been able to be acted upon even quicker now with new technologies. Yes, it's not usual, but this has been put in place to help in times of crisis like this.
That's good to see that it works. Is there anything else that anybody wants to add in terms of treatments, vaccines, or any of this conversation before we move to the last phase of our conversation together today? Okay. So let's talk a little bit about what comes next. We've talked a little bit about that throughout, but let's start with a question of, is Saskatchewan opening up too soon? And I'm going to give you a bit of a context for that first. And so, when I look at social media is, of course, not the best indicator of anything, but when I look at the social media feed for the Premier, for instance, when he's talking about opening up, about a third of the pressure is, you need to open up faster, you need to open up faster. The other third is saying, please never open up. And there's third in the middle just saying you're doing a great job. And I don't know if that's the Goldilocks effect and they're getting it just about right, but I'd really like your perspective, each of your perspectives about, given that this is not going away, are we taking the right approach? Are we moving too fast, too slow? And I'll just leave it there and get your perspectives.
I could start off if you'd like.
Sure, thank you.
I think Saskatchewan has had, as was referred to, a less severe outbreak to this point. It has had small flare-ups and learned from those flare-ups. It has not had the drastic outbreaks in long-term care and has put in place a number of measures to protect long-term care residents and increasingly to protect other populations such as those in the north. So Saskatchewan, I think, has done quite a good job comparing it to other provinces. As we go forward, though, we do need to open up, and the sociologists, psychologists can talk about that, because there are ramifications of this change of social behavior. And the economists would certainly support opening up. So we need to move in that direction. The third that say stay closed, it's not feasible. We need to open up. But we need to have, as we open up, follow principles and guidelines of what we open up in, and how rapidly we open up, and also metrics to keep an eye on the impact of opening up. And I'm pleased to say that, to my understanding, the province is quite attentive to the staging of opening up, and especially the metrics of opening up, so that we will have an early warning, several measures of early warning that things are not going well in one community or region and another, so that then action can be taken. So it seems to me that that is the only reasonable medical, sociological, and economic thing to do.
Finding that balance, right. Dr. Leis, from your perspective, what are some of the consequences and challenges of staying closed or the slow opening, and what's your perspective in terms of how we're doing so far here?
Well, I think I would concur with what Dr. Reeder has said. I think we are doing taking the right steps towards opening up, and so in stages. So that's kind of very prudent. The question is, whether which of the businesses should be open first, and which kind of which of the services should be offered, and so on. Schools, for example, or staying closed until September. So we understand because of the crowdedness, but was it the only option? Maybe not. Obviously there is a summer. So there are some questions, but I can see some of the impact of not doing a few things. So I mentioned the school, the burden on the parents, on the kids who, whatever the 6 months that they have had a bit of, not really the proper education, how it's going to unfold. There are some kind of social consequences, absolutely. And so, time will tell, how we can recuperate from that. But otherwise, what we know is that there will be a new normal. It won't be like before, we are not going back. I think we have learned things that are positive, that are feasible. Let's say using more online tools, paying attention to the social distancing, pay attention to how we behave, protecting each other. So I think there are things that I think will leave a mark, and moving forward, which is probably a good thing. So being more socially responsible as well. So I think we are going in the right direction. We have to monitor for sure.
Okay, Dr. Janzen, I'm curious about your thoughts in terms of how we're doing in terms of the opening up, but I'd like to maybe ask you to build on that as well to, as has been discussed, we're going to see waves of this. What might be the impact for people and society if we have to close again? Hopefully that won't happen, but if it does, it's one thing to come out of this and say, okay, that's great, we came out of it. Now that was tough, but that was great. And now to have to go through it again, I think we could see a doubling down of some of the effects of that could be concerning. So I'm just wondering about your perspective.
Yeah, I think Dr. Leis is right. I think people are starting to come around to this new normal. This is just anecdotal evidence, but when I'm out in the community, I see people are being generally quite respectful of people's spaces. You see some instances of people being a bit loose with the social distancing, but even with the recent opening of some of the malls, and I have to admit, I've gone in a mall near my place and was quite shocked at how few people were there, and people were just being, again, respectful of the appropriate rules. But I don't know. I think there's going to be different, I guess, subgroups who perhaps are kind of over this already and want to get back to the way things were before. That's a bit hard to predict. Actually, I'd be interested with Dr. Neudorf. I read an article, I think it was CBC, with the Google Analytics kind of tracking people, the distancing, and how over time people are getting closer than they should be. I don't know if that was a Canadian perspective or Cory.
Yeah, it was actually Canadian and broken down by province as well.
Okay.
So it's interesting to see that we've had time to learn, and I think the question about are we opening up too soon or not, again, it comes down to people's behavior. But it also, the question that should be asked is, if I want to reopen, can I do it safely? What does safely mean? Safely doesn't mean zero risk.
No.
It means keeping risk as low as possible. And there are some types of things that we just shouldn't be doing right now. There are some types of, really large gatherings, for example, that just serve as a potential for a massive outbreak that we can't do for the foreseeable future. But there are other things, adaptations that businesses are making. We've had time over these last few months for businesses to look at, what do I need to change? What do I need to do differently to keep that risk as low as possible? And we've seen some fantastic adaptations and innovations coming forward. Those businesses that have used that time and figured out those ways, by all means, let's reopen and do that safely, as long as the people then respect those guidelines and rules. And what we're seeing is a slow trend, though, back to people starting to recirculate more activities in the parks, more activities in places of business and malls, and people starting to congregate in larger groups. That's all to be expected. We don't want it to go over that tipping point, though, where it starts to result in large outbreaks again. So it's going to be a bit of a balancing act over the next months.
Yeah, good point. I have two more questions I'd like to ask, but I'm mindful of time. Does everybody have a few more minutes, or are you pressed for time?
I have to go off to another meeting, if that's okay, Mark.
Yeah, sure. Thank you, Dr. Reeder. I appreciate that. And if the rest of you have a couple minutes, we'll get through the last two questions and move from there. But thank you for joining us today, Dr. Reeder.
Thank you. I've enjoyed it.
Okay, so I'd like to ask, thinking from our readers' perspective again, and understanding what they might be wondering, what's the most important thing that people need to know or prepare for with respect to COVID-19 over say the rest of 2020? So, and I'd like to hear from each of you on this, but what's the most important thing that people need to know when it comes to COVID-19 as they're thinking about the next 6 months?
I can start if you want. I think the first thing is staying vigilant. That it's easy to become complacent, especially during this time when we've had the success of flattening that curve and keeping the virus at really, really low levels in our province. And so what we want to avoid is a double hit of severe restrictions. Businesses can't survive that, and the hospital can't. So we need people to stay vigilant and really listen to what the guidelines are. I'll give an example. When they announced the Reopen Saskatchewan plan, there's a certain segment of the population that all they heard was reopen.
Yeah.
And immediately all the other changes got thrown out the window. And there's a big backlash against that. Well, it said reopen with guidelines, and it's a phased in approach. And staying really vigilant in listening to what the details of the guidelines are, and remembering that you're doing this for yourself, that you're doing this for others in the community and for the health system. That's the most important message.
Thank you. Dr. Janzen?
Yeah, no, I'd agree. The keeping vigilant and I like Dr. Neudorf already mentioned, having that community mindedness, really thinking what you do affects others. And I think keeping that in the forefront, thinking community health as well as your individual health.
Right. Thank you. Dr. Leis?
Yeah, so I think the people, I think what they should, when we say paying attention, being vigilant, is kind of thinking about, okay, how can I actually resume some of the activities of my life, or things, seeing families and friends in a safer way. So, and kind of imagining, or trying to implement kind of ways of, instead of shopping, with the whole family, well, it will be only mom or dad going shopping. Or instead, or when we need exercise, well, let's go in open space, let's not go in crowded where there are many, many people, like just kind of trying to make decisions that will kind of help us enforce some or follow some kind of a proper distancing still, or help us enjoy things without imposing or being on top of each other, or without thinking only about ourselves. There was kind of, I had to smile when last night, I think at the news, that they were saying that they were opening camping grounds, and then because nobody can travel, and so basically they could not even, there was a rush to book camping grounds, and I do understand. So I think, what can we do, that is going to be enjoyable, but still be mindful of other fellows, community people, family, and so on. So it's a bit of a gymnastic, because we are often used to kind of only think about ourselves. So.
No, I think that's true. And so I actually think that's one of the positive things that may come out of this. And this is what I'd like to end the conversation on. And Dr. Leis, I'll give you the choice of whether you want to go first or last. But the question is, what are some of the lessons that we can draw from all of this experience with COVID-19 that may better prepare and help lead us to being a better society and better prepare us for future health challenges? And Dr. Leis, would you like to go first or last?
It doesn't matter. I can continue that. Sure. Yeah. Well, I think this kind of a pandemic forced the whole society to pause. And it was very hard, but at the same time, there were some benefits of pausing in the sense that, Oh, yeah, we had time to have supper together. Oh, we have time to actually oversee the, you know, the work of the children. Or, you know, I've heard many people that I know saying, well, actually, there are things that I forgot that were enjoyable, that we actually discovered through this pandemic. So there was certainly at, you know, at the family level and maybe even the society level, kind of ways to kind of a bit press pause and say, okay, we don't have to be that busy. We don't have to travel. We don't have to be all stressed. You know, can we just rediscover ourselves, rediscover our friends, our family, and so on. So I think this is kind of a positive that probably, hopefully, is going to carry ourselves in the future.
Thank you. Dr. Neudorf.
Well, I think I'd certainly agree with what Dr. Leis has said. We've seen people start to take a look at their own families, but also their responsibility to the broader community, and doing things for others, and how we've seen lots of examples of people just trying to help out, especially those who are more vulnerable. So those are valuable lessons to learn. I would say how some of that translates is to remember it in times of election, or when pandemics are over.
Yeah.
Do we actually want to remember this, and should we be paying attention, regardless of what political party is out there, to invest in prevention and preparedness, to invest in our community's health and in our social programs, because those are the types of things that have enabled us to weather this. And that we shouldn't, you know, there's some real good lessons learned on how quickly government can mobilize and do things to help us as citizens to weather these types of crises. And regardless of what political party is out there, this is a good reminder of the value of government and the need not just to have a mantra of small government for small government's sake, but to make sure that we're set up in a way that invests in the strength of our social programs, our health programs, in prevention and preparedness, and the wellness of our communities.
Excellent, thank you. Dr. Janzen, the last word goes to you.
Oh, yeah. Well, I agree with both Dr. Neudorf and Dr. Leis. I think one of the positive things that I've seen is that awareness, greater awareness of people at the lower rungs of the socioeconomic ladder who are out there working at Tim Hortons, you know, at gas stations and so on. There really does seem to be more of an awareness of that group and the importance of the work that those people do, and just the awareness of how people have struggled economically during this time. I don't know, I thought that was really positive. Even some of the more conservative governments seem to understand the economic vulnerability of a lot of groups in Canada. So I thought that was a positive thing. And, you know, just hearing more about having a guaranteed income for Canadians. I just thought that was a positive thing.
Wonderful. Well, listen, I want to thank you all so much for making time today. Thanks for allowing me to go a little bit longer. It was a great conversation.
Yeah.
I could literally keep talking to you for probably another hour, but I will let you go. And I want to say thank you, Dr. Leis, Dr. Janzen, and Dr. Neudorf for making time today. I know that our readers will appreciate it.